Have you ever wondered why some people seem perfectly fine after the COVID shot, whereas others are dropping dead or suffering debilitating injuries? Well, evidence has emerged that not everybody who rolled up their sleeve for a COVID jab had the same thing pumped into their arm. Young and healthy athletes in their prime of their careers are still dropping like flies, with LeBron James' fully vaccinated son Bronny suffering a heart attack at the ripe old age of 18. Teenage World Cup soccer star Linda Caicedo collapsing in training, clutching her heart. And pro-vax Premier League legends Shaka Hislop suddenly collapsing live on air. Every day the list of young and healthy athletes having heart attacks and strokes continues to grow. Despite what the mainstream media is determined to convince you, this is not normal. So what's going on? The globalist elite are no longer hiding their plans to depopulate the world. This is a multi-pronged attack, and we are now seeing what it looks like in real time. Before we dive in, make sure you subscribe to the channel and join the People's Voice Locals community to stay up to date with the community and receive exclusive and uncensored videos. A former Big Pharma research and development executive has come forward and admitted that her research revealed the industry intentionally turned some batches into rapid kill lots, designed to depopulate key demographics the globalist elite want to see gone. According to Sasha Latipova, a retired pharmaceutical R&D executive, COVID vaccines are having an enormously variable rate on adverse events because Big Pharma intentionally created bad batches, which were sent to certain parts of America and the world to poison certain types of people. If you thought the Great Replacement was nothing more than a conspiracy theory, you might want to think again.
I looked at the data, not just at the total number of adverse events and deaths, but also how the pattern of the data across manufacturing lots or batches. So all pharmaceutical products are manufactured in lots of batches. The lots are numbered. You can look at, if you go to the pharmacy and buy Advil, you can look on the box, it has a lot number. So those are the lot numbers that can be recorded in various reports when people submit their reports. And they're not always there because people who are submitting the reports, which is either patients, their relatives, pharmacists or doctors, healthcare professionals or nurses, they don't always have that information. So you may not remember what was the batch number you were injected with. You don't have your card with you, or the physician doesn't know. So, but in about 50% of the reports, those numbers are there. And so I was able to match those lot numbers with CDC lot numbers. I have a list of them. And I was able to see that not only the adverse events were high, but the variability of them by batch was extreme, absolutely extreme.
Explain that to me, the variability among them. Yeah.
So the variability meaning how many total reports are submitted for a particular batch number. So some batch numbers had 2 or 3 reports, and some had 5,000, 6,000. That should never happen. You should never. If you think about it, if you're buying, Advil today, your experience, if you're buying it today and you're buying it a month from now, your experience a month from now shouldn't be 1,000% different, because that's really dangerous. Even, if you think Advil is a safe medication or aspirin is a safe medication, or even if you're buying orange juice and your experience today and a week from now 1,000 times or 1,000% different, that's going to be very dangerous. One of those instances is very dangerous. So when you see a variability like this between batches of what is supposed to be consistently produced, good manufacturing practice compliant product, it means the product is not good manufacturing practice compliant. And I, as a comparator, because I didn't have a baseline for this and I didn't have information, for example, of the batch sizes at the time, I do now, and the story doesn't change. But at the time I didn't, so I thought I should compare it to something known, and something known was flu vaccines. So I extracted all the data for flu vaccines from VAERS, and I looked how flu vaccine data looks batch to batch over a long period of time. And by the way, it's much more much more variety of producers making different size of batches. There are dozens of manufacturers of flu vaccines historically, and different sizes of batches. And for flu vaccines, it looks as expected for good manufacturing practice compliant product, which is straight line, very close to zero. All the batches line up, and just very, very little variability, just a tiny bit. And then when you compare them to these COVID shots, that you can't even put them on the same graph. flu vaccine data disappears because the COVID shots variability is huge, absolutely huge, enormous. So I knew at that time, which was toward middle 2021, toward fall of 2021, I knew for sure they were not good manufacturing practice compliant. So we have not good manufacturing practice compliant product being produced, shipped in millions of doses, injected in millions of people, including pregnant women and children. We have CDC and FDA lying and saying there is no signal at all. And this continues for a long time.
Sashi Latipova has done a yeoman's job in compiling deaths, injuries and illnesses and cross-checking them with their COVID-19 vaccine batch codes. And the data reveals some very disturbing truths about who the globalist elite were targeting with bad batches. Big Pharma and the CDC intentionally targeted people in conservative red states with fast-acting deadly batches of COVID-19 vaccines, according to CDC data, which confirms many people's worst suspicions about the depopulation agenda at the heart of US government. Private leaked documents from the CDC reveal a list of vaccine batch expiry codes, and only certain lots are included. Disturbingly, the CDC batch codes with expiry dates are the very same lots found to be highly toxic in Craig Pardee-Cooper's How Bad Is My Batch database. This mode of deployment allows the government the ability to direct deadly batches into specific populations, such as red states. Analysis of the number of Americans dying per 100,000 people vaccinated in 50 states shows us that the overwhelming majority of vaccine deaths is happening in red states. The expose published a report of data found in the US government's VAERS, the Vaccine Adverse Event Reporting System, which reveals that 100% of COVID-19 vaccine deaths were caused by just 5% of the batches. These batches can be identified, and these batches were not distributed evenly. The 8 US states with the highest vaccine death rates per vaccination, Kentucky, Arkansas, Wyoming, Tennessee, West Virginia, Montana, Alaska, and North Dakota, are all red states. 19 of the top 24 on the list are all red states. And the state that has the lowest vaccine death rate from the deadly batches of vaccine? You guessed it, California. The numbers show that Kentucky has a 1900% worse vaccine death rate than California, suggesting that the red state received 20 times the amount of deadly batches of vaccine than California received. The author points out that these deadly batches of vaccine would be better described as rapid kill lots and slow kill lots, as we are seeing more evidence that they also kill over time, and red states were targeted with rapid kill lots. But the globalist conspiracy against humanity goes even deeper. After this quick break, we'll expose exactly how the globalist elite plan to depopulate the world of white, conservative Christians,